It's a we thing.
It's a we thing.
Greetings out there in podcast land. We are so excited this beautiful day to have with us two community health workers who are going to share with us a day in the life of a community health worker. We have with us Ms. Rosalind Stone and Ms. Carline Massey. They are both seasoned community health workers, and they are going to come to you now, introducing themselves and sharing with us some of their experiences. And we want you to know that the information in this podcast is presented per our lived experiences and should be received only as our opinions.
Good morning. As Ms. Davis said, thank you, Ms. Davis. As Ms. Davis said, I am Rosalind Stone. I am an African-American female that was born, fed, and raised in Marianna, Lee County, Arkansas, where I'm married to a wonderful man by the name of Willie Stone for 38 years. I'm a mother of 5 children with 8 wonderful grandchildren. I graduated in 1985 from Lee High School in Marianna, Arkansas, and I am so thankful to have become a community health worker. Thank you.
Good morning to you all. My name is Carline Massey. I am a native of Mississippi. I now live in Arkansas. I am married to Pastor Donald Massey. We have 2 wonderful children and 2 beautiful grandchildren. And I have my master's degree in business administration and healthcare management. But to become a community health worker in the state of Texas, I had to get certified, have a certification in community health worker because I was living in the state of Texas. And now I am living in the state of Arkansas. And I have gone through the process of being certified in the state of Arkansas.
All right. Thank you both. We are so excited to have you here with us today. I would like to hear a little bit about how you came to this work and how you love what you do. So share with us how you came about in the field of becoming a community health worker.
Okay, for Rosalind Stone, becoming a community health worker as a little girl, I was a community health worker and didn't even know it while I was assisting community members and their friends just by riding my bicycle to the store for them or riding up to the drugstore and they sending a note for me to give to the pharmacist to pick up a med, whatever it was they could do. I refurbished it and really enjoyed it by completing 160 hours through the Delta training that I received in early 2021, and it was really a blessing to receive that. But as I said, I'm from the community in which I live. My community knows me. I know my community. I know what resources are available within my community. So therefore, I'm able to assist my community with several resources. And if not, I know people in big places and small places as well that I could go to and ask questions about what's going on in community. And because they see me in community so well and know what I do in community, they often come to me and ask me for resources. So therefore, I can go to resources from them as well. But as a little girl, as I stated, I was doing community health worker work, and I didn't even realize that I was doing the work of a community health worker. We have to use various skills like our interpersonal skills as well as our communication skills, to help build trust with community members that move in and out of community, because word gets around in community about who you are and what you are. That's why as community health workers, we have to be careful with the walk that we walk and the talk that we talk while we're in community. Thank you very much for allowing me to share.
And as a community health worker, as Rosalind has stated, I started out a little girl in Mississippi, helping my grandparents. My grandmother would always call me over and say, "Hey, I don't understand this. Can you read this paperwork to me and help me fill it out?" So I started out with family, and then, family talked to other people. And so I started with their friends. So I started young, filling out paperwork. And so it just became a part that I just felt like I needed to be able to help the community. And then when I got older in the church, we would do Christmas meals, Thanksgiving meals. We would do boxes to give to people in the community that we knew that needed assistance. And then we would also fix meals, and we would give out meals, and we would have big meals at the church to feed the community. on those holidays. And so that's basically how I got started. And even as a young girl, I say a teenager, I remember having to stand in line for my grandparents to help them fill out that card to get commodities. So it goes way back, and I probably just told my age, but that's actually how I got started as a community health worker. And as long as I can remember, even when I went to school to be able to assist them, my community, to be able to get resources and stuff that they needed, still not knowing I was going to school to be a community health worker.
All right. So from what I hear, this didn't start just yesterday. This has been a life that you lived as a community health worker. You didn't know you were a community health worker, but you were a community health worker, and you still are. So now I would really like to hear a little bit more about what your day is like. Talk about how you move about in the field, how you start your day, how you prepare for your day. What's your order of business? Share with us a little bit about a day in the life of a community health worker.
As a community health worker, my day starts with just being thankful for seeing a new day. And then you think about the things that you need to do in community. You always want to be prepared as you go out in community. You want to make sure that you're organized. You want to make sure that whatever you have to bring to the table for community members in your community, that you have it in your bag or whatever it is that you have. And then you go on about your business with making sure that you're in the community in the right spot. For us at Tri-County Rural Health Network, where I work, we find community members by way of just going into a different segment of community, standing in community, passing out flyers and our brochures or our business cards, letting community members know that we're in your community. We are full of resources, whatever it is that you need, we try to assist you with them. We also do by just knocking on people's doors. And when I'm knocking on doors to try to help people with anything that they need in the healthcare field, home community-based resources, things like, if they need Medicaid, we actually do what we call a Medicare savings. We assist with their program where community members that receive Social Security, if they take that $170 out of their Social Security check for their Part B premium, if their income guidelines makes them eligible and they qualifies for it, we actually assist them with those applications. I do the footwork for them. I'll go to get the application, whatever it needs. I have them to know that whenever you hear from the DHS officer, whoever it is that says that you are eligible, you do not, we make sure that we follow up with them to make sure that whatever service that we tried to assist them with, that they received it. And if they did not receive it, is it something that we can do different, or is it something that we should have done that we didn't do? So we go back and we try to make sure that happens. We also, as we're in community, you just looking for different people that are in need, and word of mouth travels. And so if you help or assist someone with something, then they're going to share with someone else. Even in our personal lives as a community health worker, if you out in community and you go on your personal life and you going into stores and things, community members see you. And so a lot of times they want to conversate with you about a service or something that they might need. So you just have to share and let them know that, I am available, and let them know your hours of availability. But sometimes it's not always like that. As a community health worker, we just try to help people wherever they are. If they're there and they need the help and it's something that we can do on that particular day, we'll go ahead and we'll try to do that for their community members. And so that's how that I do my day. I'm in community, knocking doors, looking for community members. And as they share the things that they need, resources, we try to help them with providing those resources. Thank you.
And for me, a day as a community health worker, for me, I have to stop and say this. I am actually living in Arkansas, but you cross the street, I am in Texas. So actually, I do a dual. I'm a community health worker for the Texas and Arkansas, because I work for UAMS, and we do take Texas patients and we have Arkansas patients. And with that being said, also I have been certified as a community health worker for the state of Texas, and in the process of getting certified for the state of Arkansas. And that, with that being said, my day started out with a prayer. I started out with a prayer of thanksgiving, and I also start out with a prayer of direction, because a lot of times when I am doing outreach, because that is also part of my job to do outreach, and I'm in the community going to faith-based organizations, I'm going to healthcare clinics, I am going to different senior clinics. And so I meet a lot of people needing a lot of resources. And sometimes in the state of Arkansas, we just don't have those resources. So I have to have some kind of guidance and direction on how to help take care of the need of the patient. So also, as with that being said, so part of my day is out advocating for the patient also. And I spend my evenings in the office trying to reach out to my patient to see how they're doing. I do follow-up calls. I do initial intake calls. And I also do resources. I research resources that as a cancer navigator, there is so limited of resources for our cancer patients. So a lot of my time is spent on resources, searching for resources. And as Rosalind stated also, so you have to be very organized. And I try to make a list at the end of the day, the things that I need to do at the beginning of the next day. But sometimes that works and sometimes that doesn't.
All right. Well, it's so fascinating to hear about a day in the life of a community health worker. And I can just see you out there moving in the community and doing your thing. But what I'd like for you to share with us now is a story. Share with us a story about a community member that you may have provided assistance with that really struck you or really stayed in your mind, or it's one that you just can't forget.
Yes, ma'am, I will. This story is very old, but it's one that has stayed in my heart for years and years, and it's still in my heart. As a young mother, I had, I shared that I have those 5 children. So my children had a friend that lived out in the rural areas of Lee County, Arkansas. And this child would call my children daily and would ask, what do your mom do? So while I was out one day doing door to door, I was out in their neighborhood, and I put one of my flyers on their door. So when he come in that afternoon from school, he saw it. And he had been worrying and toiling with his mother, who was a foster parent, and she had fostered over 30 plus children, and he was one of the last one. And so she adopted him, and so she became his mother. And so her mother, his mother's mother, which was 80-some years old, was taking care of her daughter, who was the foster parent. And she had become very ill and didn't know of any resources. And her son that she adopted, he was going to quit school in order to take care of his mother, because his mother's mother, which was his grandmother now, she had become disabled, the 80-plus-year-old lady. She had had a stroke or fell or something. And he thought that he had to quit school in order to take care of now his mother and his grandmother. But in talking to my children and leaving the flyer, he actually called one evening to my home, and he asked to speak to me. And I'm like, well, why are you calling my house so late at night? He said, I want to talk to you, not your children. So he asked me what I did, and I told him, and he shared his story about his mother and his grandmother, and that he was going to have to quit school. And I told him that I would come out there next morning, that I usually start work at 8, but I would be out there at his house about 7:30. So I made it out there. First thing I did was looked around and seen what resources they had and maybe what they needed, and found out that the mother did not have Medicaid and she did not really qualify for it. So because of her status, we were able to assist her with a Medicaid waiver program, which at that time was called Elders Choices. Now it's ARCHWA, but it was Elders Choices. And so we were able to assist her with the completion of that waiver application. And getting that application completed, we was able to get her a home health aide, as well as a personal care aide, someone that could be there during the day while her child was at school. We were able to get her medical equipment, things like a lift to help him to lift her up and down out of the bed, because he was actually lifting her himself. So we was able to get a lift. bedside come on. We was able to get her a bed that she could operate to get up and down with the mattress so that she would no longer have the bed sores. We was also able to connect her with a service that was called Meals on Wheels so that she would have a meal during the day while he was gone to school. So after doing all those resources, he was very, very happy. He wasn't even out of school for 2 days while we was trying. I told him while we was doing this, he got his auntie to come over and sit while they had to wait the 30 to 45 days for the eligibility for the Medicaid waiver. But however, they were able to get all of those services. He was able to go back to school, well, not go back, but go finish school, his 12th grade year. And now he's doing wonderful. Young man still calls. We see him from time to time when he comes through Mariana. He will stop by my house and share a little love with me. Thank you so much for letting me share.
Ms. Stone, I believe you said he even graduated college. Is that correct?
Yes, ma'am. He went to EACC where he took up some college hours, and I don't know what his profession is, but he went on to, when he left EACC, he went on to the college in Jonesboro.
Mm-hmm. Arkansas State.
Going on with his life.
Thank you.
And for me, I have worked in different capacities as community health worker. So I'm going to talk about a patient, a medical patient that we had. And one of the providers, I had received a referral from a provider, and it was the patient needed a home where he could go because he was 17 years old and on the street, and he was homeless. And the young man weighed 88 pounds. And so he was malnourished, and he had several different diagnoses. And so he wasn't getting, well, one of his diagnoses was he was a diabetic, and he wasn't getting the proper food, and he had whittled down to nothing. And he didn't have any resources. He didn't have any money. He didn't have any family. He had a grandmother, but due to her living conditions, she wasn't able to take him in because she was living with someone. And so it was on me to find someone that would take him in, that he would be able to get proper meals, and he would have somewhere to stay. He could not live in one of our shelters due to some of his diagnosis. So I had to reach out to a lot of people that I had networked with, and we were able to get him into a home for a boys' home. And they were able to take him in, and they had a chef that was there on site that would cook. And so that he would cook just special meals for him. And after the first month there, he was 88 pounds. And so he had gained 20 pounds. And he came by to see me to let me know that he was doing good at one of his office visits. So every time every time he had an office visit, he would come in and let me look at him and see that he was doing well. And so he was able to stay there for 3 years. But he would, when he was able enough, they helped him find a job to work. And so he was able to work, and he was able to, after the 3 years, they gave him a bonus, some kind of bonus, and they got him a housing. They put him in housing, so he was able to continue on and have a productive life. And that's the day in my job as a community health worker.
Wow. These are fascinating experiences that you have been engaged in. I am so pleased that you're here with us today. We have thoroughly enjoyed your presence, and we know that what you do has to be a difficult job. And so I'm really hoping that you're taking care of yourselves and that all is well. Ms. Collins.
This has been a day in the life of a community health worker, Anna Huff Davis and Naomi Collins, your podcast host. We hope you've shared something that you have enjoyed and gained from today, and we look forward to talking with you at our next podcast. It's a we thing.
It's a we thing.